Well, hello there. It's Dr. Brian McKay, not just a chiropractor, Stamford, Darien, Norwalk, New Canaan. All right. Well, what exciting topic do we have to discuss today? Well, back pain may not be exciting to you, but since I treat back pain just about every single day I'm at work in my chiropractic office, I decided today I'm going to grace you with just another exciting topic. I want to talk to you about the combining of modalities, okay? This day and age, insurance reimbursement is really not very good. So people are reaching into their own pockets to pay for treatment more and more. Or if they have insurance, it's like a $10,000 deductible, or it's an HMO and they don't cover anything. But what happens is someone comes in. I always feel like I have an obligation to get them better as fast as I quickly can. And by using therapies, multiple therapies on each visit, I think we're able to accomplish faster results, uh, much faster results, much more comfortable patient satisfaction, and it just enhances the process for someone. If you're in pain and say it would take me 4 months to get you better before, I could do it in two now because we have the right tools. I think that's a good thing. So basically, someone comes into me with a bad low back. All right, I'll first examine them, do my tests. But a lot of times, the structural stuff is just the bony part, which chiropractors mainly treat. With the chiropractic adjustment is the main driving force, and sometimes that's the only thing people will get if they go to other practices. I don't really particularly think that's a good way to practice, but it works for a lot of people. And listen, that's the way they do their things. I do mine differently. So years ago, we started doing a procedure called spinal decompression. And spinal decompression is a fantastic way to get fluids back into the disc space. And a lot of times discs are herniated or bulging. And that extra pressure kind of like squeezes the juice out of the disc, much like a dried sponge left on the side of your house, on the side of your sink. Well, what we do here is we put most of our patients, actually, we got two machines going pretty much on a regular basis. It distracts the joint and allows the fluid, the cerebrospinal fluid, to go into your joint space. And it takes out inflammation. Because when you have pain, there's always inflammation. You really can't feel inflammation. But if there's pain, there's inflammation. It's just a natural process. So by allowing the disc to come back to its normal disc height, by bringing fluid back into this, basically rehydrating. You have a dried out sponge, wet it, pops back up. Similar thing with a disc. A way I tell people to think about it is, say you're brushing your teeth. Hopefully you do brush your teeth. And what happens is you squeeze the toothpaste onto your toothbrush, and there's a little bit left out. You relieve the pressure on the tube, and all of a sudden that little bit of toothpaste goes back in. The whole principle of spinal decompression. It should make an awful lot of sense. So that's one particular thing. So I'd say we come in, we do the chiropractic adjustments. Now we do spinal decompression. There's also other pain, like when someone's in acute pain, different electrical modalities we use that try to beat up the nerve pain, try to cancel out the nerve pain signals that will make the person more comfortable. And it's really just to get the fire out as far as the nerve pain. Nerve pain is probably what makes most people pick up the phone and call us, and it's a great way to do it. But that's the topic for another day. So basically, we take a look at the soft tissue aspect using a technique called trigenics. It allows me to identify which muscles are not working properly via either a thing called muscle spindle cells or Golgi tendon organs. Again, that's a topic for another day. So if you come here to see me, we're going to do the chiropractic treatment. We're going to do soft tissue trigenics treatment, then decompression, and another one is really phenomenal. It's called shock wave therapy. And shock wave therapy is a fantastic way to break up adhesions. Now, you're going to ask me what an adhesion is. Think of your muscles, and you have muscles that are, think of your muscles supposed to be like a grape. But over time, a lot of stress placed on that muscle because the muscle has to work harder when the bone is not ideally situated. The muscle now looks like a raisin where it's supposed to look like a grape. Shockwave therapy uses this pneumatic device to break up adhesions, and then it allows the cell to start going back to its normal, like more like a grape than it was like a raisin. And that's a fantastic treatment. But when you combine these different treatments together, it has a great effect because you're kind of attacking the problem on many levels. I mean, okay, you may just think, hey, I take an Advil and my pain's gone. And in many cases, Advil's going to do a great job of taking out your pain, but it's not going to really fix the structural issues that really do need to be addressed. And that's where stacking of modalities can become a really great way to get someone better faster. And then, of course, exercises and other rehabilitative things that you can do at home. But for the most part, it's a really great combination to go in and really attack a bad low back. So you take all these, well, let's just name four different therapies: the chiropractic adjustment, the trigenic soft tissue treatment that works on the spindle cells and the Golgi tendon organs. Then you have decompression, and you add in shockwave. A powerful, powerful combination that can really make a difference and alleviate a lot of low back pain, but also a lot faster, which then saves the patient money too. So I think it's a fantastic thing. If you have any questions, you can reach out to me, 203 656 3636. 203 656 3636. I'm Dr. Brian McKay, not just a chiropractor, Stamford, Darien, Norwalk, New Canaan. Have any questions, give me a shout and have a great weekend. Thank you very much for listening.